Hello everyone. Welcome to Health Courier Solutions. It's a comprehensive medical coding guidance platform for US healthcare. My name is Keke, and I have been a part of the US healthcare system since last 11 years, and I'm a multi-certified medical coding professional. So through this channel and the video, I would like to provide you an insight and a one-stop solution to all your medical coding queries, be it related to training, certification, or any other details you may need in order to pursue your career in medical coding. So let's begin with the qualifications that are required to be a medical coder. So a graduate or postgraduate in any discipline who can become a medical coder. When I say a graduate, most preferably it is a life science graduate who are always preferred over the non-life science graduate, because a life science graduate would be would have enough knowledge to understand the human anatomy and physiology and the medical terminologies which are basically required for medical coding process. When it comes to a graduate, okay, and medical coding, the association is with the certification and the non-certification. So a certified candidate is always preferred over a non-certified candidate. When I say certification, the certification to pursue your career is provided by the AAPC and the AHIMA. These are the two different bodies. They are authorized under the US government to affiliate candidates to pursue their career as a professional medical coder. So therefore, certification is a must criteria, and a certified candidate is always preferred over a non-certified candidate, be it in terms of their salary, other skills, because a certified candidate has always undergone the training for the medical diagnosis, medical procedure, and they have the overall and comprehensive understanding of medical coding. Let's understand the process of medical coding, with a comparative study of US healthcare system and Indian healthcare system. So generally in India, whenever a patient visits a physician, they would have a communication, a conversation related to patient's medical history, or the physician will examine the patient and they will prescribe some medication in order for the patient to get cured. And patient will pay a visiting fees to the physician directly either or in the billing counter. Whereas in United States, most of the patients, they are covered under the medical insurance. As the healthcare expenditure is extremely high, therefore government has made it necessary for most of the citizens to be covered under the or to be enrolled under a particular healthcare insurance plan. So whenever any patient visits a physician, they don't pay the service directly or the fees directly. In order to get that fees, there is a long process, therefore making it easy, accessible for all the patients to get quality healthcare from the government. So whenever any patient visits, all their conversation, be it their medical history examination and the prescription, that is assessment plan, everything would be recorded, and the same recording will be sent to the medical transcriptionist. And here the medical transcriptionist, they will convert that recording, that audio recording, into electronic medical record. And that electronic medical record, the readable format, that will be taken by the medical coders, and they will perform the coding based on their skill set or based on their certification or based on their areas of expertise. If it is a diagnosis coding, they will perform the diagnosis coding. If it is a procedure or surgery coding, they will perform the surgery coding. So in coding, basically they will convert the diagnosis or surgical procedures into universal codes, which would be easy for the medical billers to understand. and to generate the bill for the reimbursement of the providers. When I say reimbursement and the provider, here provider means the physician who has performed the service, and the reimbursement, the payment what physician need to get in for their service performed. Now, the role of the medical coder is very important because whatever the document physician has prepared and the transcription has transcribed, the same document must be correctly interpreted by a medical coder to get the appropriate payment for the physician. If the medical coder is not well trained or do not have sufficient knowledge to perform the coding, then it would lead to overcoding or undercoding. Thereby, there will be a huge variation in the billing process, and this particular variation, it leads to a lot of wastage of the government revenue. Now, let's move to the next slide. The objective of this video, basically, primarily to educate everyone on medical coding, be it the existing folks or the the freshers, the latest passed out candidates who are looking out for a career in medical coding, and to understand the US healthcare system and making it better, creating job opportunities, and most importantly, the privacy and the confidentiality of a particular patient, of all the patients. Okay, now when I say the health data, that is protected health information, and every patient is covered under the HIPAA and HITECH rules and HIPAA and HITECH guidelines. Therefore, every medical coder or any professional who's involved with the process of revenue cycle management, they must be aware of the HIPAA, that is Health Insurance Portability and Accountability Act, which says that violation of any healthcare data or leakage of any healthcare data by any authority will be liable to pay the penalty or imprisonment under this HIPAA rule. All right, so all of us, while coding for the medical process, we also need to understand that there is a huge and very stringent and strict guidelines that have been set by the HIPAA to maintain the confidentiality of the patient's healthcare data, unlike any other country. Now, when it comes to career placement, one need to understand one should be qualified, skilled enough to place themselves, and how to do that. We will help you understand how to place yourself in a particular coding industry to earn more, to have a good life financially with that stability. Moreover, while working, you must know how to handle your client, how to create business opportunities in US healthcare system, how to get the business outsourced, and with that integrity and honesty, how to maintain your business. So that's all for today. We will keep coming with the other videos and the detailed videos of different scenarios, coding related scenarios, or training, certification. So always stay updated. Please do like, share, and subscribe, and please do not hesitate to put your comments below for any of the materials or any other details that you may need. Thank you very much for today. See you on my next video.